is, and I know some of you probably seen me talk a little bit about nutrition and Alzheimer's before, but what I want to talk about today is some of what we know with regards to nutrition and Alzheimer's, and some of what we're doing at our Alzheimer's Disease Research Center to better understand how nutrition and Alzheimer's treatment and prevention can be sort of mitigated through these nutrition approaches that we're looking at. So it's probably well known to many that Alzheimer's disease is one of the most commonly cited concerns with older adults, in that 1 in every 9 of people living in the United States that are older than 65 years old has Alzheimer's disease. And if we look at sort of where we're at the moment, there's about a little over 5 million people to 6 million people in the US that have Alzheimer's disease that are over the age of 65. And as we continue through the following decades, that prevalence is expected to grow. There is some encouraging data, though, recently that suggests that we might be getting better at preventing Alzheimer's disease, but there's still a lot to be done. Some of this maybe through some of the information that we've learned about nutrition and exercise and these types of things that our Alzheimer's Disease Center is looking at. But even though we're getting better at preventing it, or at least seems like we might be getting better at preventing it, there's still a lot of work that we need to do. So you've probably heard this from a lot of different speakers at the Alzheimer's Disease Center, and I know you've heard me say it multiple times. But we're really looking at this concept of what's good for the heart is good for the brain, and diet really ties into that. So we're trying to do everything we can to improve the overall metabolic status of individuals through, alleviating some of these issues like high blood pressure and cholesterol and the risk of having diabetes, because we know a lot of these things also are risk factors for the development of Alzheimer's disease. So diet really plays into this concept because through the years, we've seen that countries that adhere highest to a Western diet, which are diets that are that have high intake of saturated fats and high refined sugar and processed food intake, which usually leads to excessive energy intake, that in those countries, that's where we see the highest prevalence of Alzheimer's disease. And there's a really nice case study from Japan where as individuals consumed a more traditional diet, there was much lower incidence of Alzheimer's disease. And then as the country has moved more toward the adaptation of a Western diet, as well as having increased incidence of obesity and diabetes, so too has raised the prevalence of Alzheimer's disease. So there's a few case studies like this across the world. Japan happens to be a really good case study that shows this nice relationship. Now, whether that's completely caused by adaptation to the Western diet or not is unknown, but it seems like it's a pretty likely contributor to that. So one of the focuses that we have at our research center is trying to prevent and treat Alzheimer's disease by making our brains use energy better. So there's a few different really strong focuses in Alzheimer's disease. Many of you have probably heard about the accumulation of amyloid proteins or amyloid plaques in the brain. That's a really important part of Alzheimer's disease and the progression and development of Alzheimer's disease. But there's also changes in brain metabolism that occur well before individuals ever actually have the disease. So this is where we're focusing with our nutrition approaches. And so what we think might be happening here is if we consume a healthy diet, that we're probably influencing healthier brain metabolism, whereas if we eat an unhealthy diet, that we're promoting poor brain metabolism. And so if we're changing this brain metabolic status through diet, that if we aim for healthier diets and diets that improve brain metabolism, perhaps we can reduce the risk of Alzheimer's disease and potentially use it for some level of treatment. So I want to talk a little bit about what we know with regard to prevention of Alzheimer's disease, because there's been some pretty good studies that suggest different diet patterns are probably good for preventing the development of Alzheimer's disease. And one of them is the Mediterranean diet, which I'm sure you, if you've been around our Alzheimer's Disease Research Center for long enough, you definitely will have heard of this diet pattern. And it suggested that those that adhere highest to a Mediterranean diet have the lowest risk for Alzheimer's disease. There's a lot of other benefits that come with that. There's a lot of cardiovascular benefits that come with that. But what we also have found is that even if there are small changes made in the diet towards consuming a Mediterranean diet, that even those small changes can have a pretty big effect. So if you are not familiar with the Mediterranean diet, there's a very nice pyramid that shows you sort of what the diet's components are primarily made up of. So included on here is regular physical activity. So that's sort of a construct within this that is important. But from a food perspective, the consumption of whole grains, very high intake of vegetables and fruits, plus beans, legumes, and nuts, using olive oil as your primary fat source, cooking oil, and like salad dressing. That's a very unique component, or a very important component on the Mediterranean diet. Then eating smaller amounts of cheese and yogurt, making sure that there's fish on the diet, and then as you work your way up, having few sweets and a lower amount of red meat. So some studies that have looked at adherence to the Mediterranean diet and risk for Alzheimer's disease show that if you do eat, if you are in the highest adherence level of consuming a Mediterranean diet, that you have the lowest risk for developing Alzheimer's disease. So if you follow these trajectories, what this study did was they measured dietary intake in a little over 2,000 people, and they followed them over time and followed their conversion to Alzheimer's disease. And those that they determined to have been consuming the highest adherence to the diet were the ones that that was the group that had the least conversion to Alzheimer's disease. Whereas if you step down a little ways, that if you were in the middle group, that you had you weren't quite as protected, but you still had some level of protection against those that had the lowest adherence to the Mediterranean diet. So this was a really interesting study from the early 2000s that sort of put this idea of following a Mediterranean diet on the map with regard to preventing neurodegeneration in the brain. And then a follow-up study to this from another group, they measured the intake of the Mediterranean diet in about 674 people. They measured their brain volume using an MRI scan, and then they related the two of those things together. And those people that were high adherers to the Mediterranean diet had larger brain volume than those that were non-adherers to the Mediterranean diet. So again, more evidence that the Mediterranean diet is really important for brain health. Some of the work that I've been doing through the years now has been looking at how sugar intake and highly processed foods influence brain health. And a couple of recent studies that I've published here suggest that if you eat a very high glycemic diet, or a diet that's high in these sugary and processed food items, that your risk for having a higher amount of amyloid in the brain is much higher. And amyloid, as I had mentioned earlier, is a pretty important marker in Alzheimer's disease. It's highly involved in the pathogenesis of the disease and the progression of the disease. And it's a pretty strong risk factor for development of Alzheimer's disease. And what we have seen is that these sugary diets may be contributing to the processing of these amyloids in the brain. So I like to follow some of this scientific evidence up with just some recommendations. And there was this very nice study done in Chicago by a group that developed a diet called the Mind Diet. And some of you might be familiar with this, but the Mind Diet is a very specific sort of version of the Mediterranean diet. And so I wanted to leave you with some very, very specific recommendations based on what they have been researching. And what they found is that for optimizing brain health, people should plan to eat green leafy vegetables every day, at least one green leafy vegetable every day, at least one serving of another vegetable every day, a serving of nuts on a daily basis, which those could be any kind of nut. Commonly, almonds and pecans and walnuts get a lot of notoriety for being some of the healthier nuts, but really all nuts are pretty healthy and have really healthy fats in them. They put a strong emphasis on consuming several servings of berries every week, especially blueberries and strawberries, which are really high in antioxidants. Eating 3 to 4 servings of beans every week. Eating whole grains, 3 servings of whole grains daily, and making sure that those are replacing refined grains like white bread and processed foods. Eating at least 1 serving of fish per week, especially fatty fish like salmon, and tuna is another good option. Eating poultry as a common protein source. Eating olive oil as the primary olive oil, or as the primary cooking oil and salad dressing. And then there's some suggestion from their research that wine is also beneficial because it has this powerful antioxidant and polyphenol called resveratrol, especially red wines. They also have recommendations for foods to avoid. And so they, sort of like we saw on that pyramid earlier, red meats are suggested to be eaten rarely. Butter should be eaten no more than a tablespoon per day, and they are very strongly adamant that you should not eat margarine, that if you are going to eat something like that butter is a better choice, but to make sure that that is restricted into small quantities. Eating a small amount of cheese, making sure that you don't eat more than a serving of cheese per week, which I know that one's a tough one. And avoiding pastries and sweets as much as possible, and avoiding fried and fast foods to keep that to less than at least 1 serving or less per week. So shifting gears a little bit, we also focus a lot on treating Alzheimer's disease with diet. And so we have some studies that are looking at this. And I'll talk a little bit about some of the studies that we have ongoing, and I've got an exciting new study to talk about as well. So I talked a little bit about amyloid in the brain, but I also made mention about changes in brain metabolism in Alzheimer's disease. And these changes in brain metabolism can occur well before the development of Alzheimer's disease, but they become the alterations become very strong in patients that do have Alzheimer's disease. So what this figure shows here is this is a PET scan, and it uses these colors to show how much metabolism is occurring in the brain. So these reds and yellows, the warm colors, those indicate that there's a lot of glucose metabolism occurring in these regions, and the greens indicate that there's less glucose metabolism occurring in these regions. So on this right-hand side, there is an older adult that does not have Alzheimer's disease. And what we see here is that they have a lot of reds and yellows, indicating that there is a fair amount of glucose metabolism occurring in this brain. And if we compare that to an Alzheimer's disease brain, you see a lot more of the greens and blues and a lot less of the reds and yellows, suggesting that this brain is not able to metabolize or utilize energy quite as well due to the Alzheimer's disease pathogenesis. And this is a bit of a complex figure, but what we're looking at here specifically is on the top here. These are healthy older adults compared to younger adults. And what we see is that there's going to be changes in this glucose metabolism as we age. It's sort of a normal thing that occurs. So if you compare cognitively normal and healthy older adults to younger individuals, you see that we see brain metabolism reductions of about 10 to 15%. But then if we compare a patient with Alzheimer's to that person that is an older adult, a healthy older adult, we see further changes in brain glucose metabolism by about 20 to 25%. So if you were to compare this person to a younger adult, there is a large amount of change in brain metabolism beyond just normal aging that occurs. So this is one of the places that we're really interested in hopefully treating as we're thinking about how we can use therapies for Alzheimer's disease. So we're focusing on this brain metabolism, and what we want to do is try to use diet to improve brain metabolism. So there's a couple of different diets that we're interested in looking at, and these are both being looked at in a clinical trial that we have going on. The first is a heart healthy diet, and the second is a ketogenic diet. So the heart healthy diet is the diet that's recommended by the American Heart Association. It's typically a low fat diet. It promotes eating lots of vegetables and fruit, eating beans, plenty of fiber, and oftentimes what we think of as being that heart healthy kind of low fat diet. And there's a lot of benefits that come with that. There's cardiovascular health benefits that come with that. It's been shown to help cholesterol and reduce risk of heart attack and all of those things. And so what we're testing here is maybe if what's good for the heart is good for the brain, perhaps that's also true in patients that have Alzheimer's disease. And the second diet that we are looking at is the ketogenic diet, which some of you may be familiar with, and it may be a new concept for a few of you. But the big difference here is that the ketogenic diet is very high in fat and very low in carbohydrate. So where the normal diet is typically high in carbohydrate and low in fat or lower in fat, this diet is high in fat, low in carbohydrate. So you flip-flop the two. This diet's used pretty well with patients that have epilepsy, and it controls their seizures pretty well, both in children and adults. And the reason why it's called the ketogenic diet is that it uses the fats from the diet to turn into a fuel called ketones that the body can use. Oftentimes when we're eating carbohydrates in our diet, those are turned into glucose that we use for fuel. So what this diet is trying to do is move away from the use of glucose by using these ketone bodies instead. The version of the diet that we use in our studies, we include a lot of non-starchy vegetables, greens, and really any kind of low-calorie vegetable that you can think of. It's loaded with lots of avocado, fatty fish, nuts, and olive oil. And because fruits are high in carbohydrate, we have to restrict fruits, but we do encourage a little bit of like berry intake, blueberry intake. We have to reduce starchy vegetables like potatoes and sweet potatoes. We more or less eliminate grains, and sweets can't be consumed on the diet either. So some of you might be familiar with like the Atkins diet from the 90s and 2000s, where you could pull into a McDonald's and say, hey, I'm on the Atkins diet. I want my cheeseburger to not include the bun. And that would get you, this was used for weight loss primarily, and it was pretty effective at helping people lose weight by doing this. But this is not really what we're talking about when we think about it for these studies that we're interested in with Alzheimer's disease. We're really interested in these more nutrient-dense approaches that are following this ketogenic diet sort of protocol, but also include lots of green, lots of nutrient-dense foods as well. So we've done a previous study on the ketogenic diet. This was my doctoral work. And we enrolled 15 patients with Alzheimer's disease. And what we were wanting to see is whether or not they were able to follow the ketogenic diet for 3 months or not. While they were on this diet, or while they were following this diet and I was helping them through it, we also tested cognitive scores at the beginning and end. And what we found was that in the majority of people that were compliant with the diet, that there were pretty large improvements in their cognition. One person did decline This person came off of their normal medications that they were using for Alzheimer's disease, so we think that could have been playing a part in that. But we did see some interesting, sort of compelling and promising results with that. There's another study that came out right after we had done this called the BEAM study, and it was done in Wake Forest. And they enrolled 20 patients with Alzheimer's disease. And what they wanted to do was see if they could get their patients to follow either a ketogenic diet or a heart healthy diet for 6 weeks. And they were successful at that. They measured some very important biomarkers in Alzheimer's disease by using MRI and by doing spinal taps and measuring some of the proteins in the spinal fluid. And I don't really need you to interpret this graph, but what this figure shows is that that both diets, the ketogenic diet and the heart healthy diet, were actually beneficial to these Alzheimer's related biomarkers, which gave some compelling evidence that both of these diets may be good at looking at for using for Alzheimer's treatment, or at least helping reduce some symptoms in Alzheimer's. I mentioned that we have another study now that I just learned 2 days ago that it's funded. We have a study where we're going to look at using creatine monohydrate, which is it's a supplement that's normally used in sports performance, but has gained a lot of interest for its potential use in targeting brain metabolism, which again is what we're interested in. And what this comes off of, there was a really nice mouse study that was done just at the end of last year, where they took mice and they put them on they gave them, these mice had a model of Alzheimer's disease. So these are mice that are bred to have sort of an Alzheimer's type condition. And what they did was they took these mice that had this Alzheimer's condition, put them on creatine monohydrate for 8 weeks, and then they measured what their brain energy output was, and it improved after being on this creatine supplement. So it suggested that their brain energy metabolism was improving. And then they also measured their cognition by having them go through a maze and determine how quickly they could get through the maze after learning. And they found that the creatine monohydrate was beneficial for learning and helped improve the cognition in these mice. So what we're doing is we're trying to determine whether or not this is going to translate into humans. So we're going to do a trial that sort of emulates what they had done. So I'm going to talk a little bit about some of the current trials that we have at the Alzheimer's Disease Research Center. There are 2 diet-based trials. One is called the NICE study, which is the Nutrition Interventions for Cognitive Enhancement. It is designed to determine how nutrition may prevent Alzheimer's disease. And we also have a treatment study called the TDAD, the Therapeutic Diets for Alzheimer's Disease, which is looking at the heart healthy and ketogenic diets for treatment of Alzheimer's. And then this upcoming clinical trial is going to be a treatment trial. We're going to call it CABA, and it's creatine to augment bioenergetics in Alzheimer's disease. Unfortunately, the NICE study is no longer enrolling. That's actually good for us because it means we're getting really close to the end of this study, and we're really excited to see what we learn. But what we did was we asked people to follow the low fat and heart healthy diet for a year, and also the Mediterranean diet. So the low fat diet or the Mediterranean diet for 1 year. And we were comparing whether or not one of those diets is better for cognition and brain health in preventing Alzheimer's disease. So we expect to have sort of the end of that study coming up here in about a year from now. And then our TDAD study is currently enrolling. We're going to enroll 80 participants. We still need I think we need about 55 or so. So we still have a fairly long way to go in that study. And this is for patients that have Alzheimer's disease. So this is a 3-month study where we're asking our individuals that are in this study to follow either the ketogenic diet or the heart healthy diet. And again, we're testing whether or not one of these diets is better for improving cognition and also brain health and function. And then this new CABA study using creatine monohydrate We're anticipating this one to start enrolling sometime around June, so sometime early summer or maybe late spring. We intend to enroll 20 participants with Alzheimer's disease, and it's going to be an 8-week intervention where we ask our participants to consume 20 grams of creatine monohydrate per day. And all 20 of these participants are going to receive the intervention. So there won't be a control group. They'll all just receive the intervention. And what we're going to be looking for is whether or not there are changes in cognition, brain health and function. And we're also going to test for some muscular changes, and basically muscular strength is what we're going to look at, since we know that creatine is involved in muscle metabolism and is commonly used for a sports supplement. So as I mentioned, the NICE study isn't enrolling anymore, but the TDAD study is. So I've got some contact information for you if you're interested in these. Our study coordinator for the TDAD study is Jessica, and she'd be happy to talk with any of you if you're interested in participating. You can always call the KU Alzheimer's Disease Center as well and talk about any of these studies that you're interested in. That contact information is there as well. And there's still more to come with the CABA study. So we will update you as there's new information about that. So that gets through all of the information that I had for you today. So I'm going to leave this contact info up for you in case you want to reference it. And I think I have a couple of questions here, so tie into those. So the first one is, what are my thoughts on utilizing a ketogenic diet? So I think the ketogenic diet has some really promising evidence for some of these conditions that have brain metabolism changes, things like Alzheimer's disease. There's a lot of other, there are a lot of other conditions that it's being looked at for. I think it has potential for a lot of conditions. It is one of those diets, though, that I don't think everybody should go on, because we know that our genetics sort of determine metabolism and the types of diets that we should be following. So I think we need to learn a lot more about that, about how these diets interact with genetics and what the most optimal diet might be for everybody. So I'm still pretty hesitant to say that it's a diet that everybody should follow. But I do think it has a lot of potential with regard to some sort of treatment in some of these neurodegenerative diseases. There's another question here. Some doctors are calling Alzheimer's disease the new diabetes type 3 and are promoting the ketogenic diet to metabolize fat instead of glucose. Yeah, so to that point, right, the diabetes is a risk factor for Alzheimer's disease. We see some really interesting changes in glucose metabolism in Alzheimer's. So I think that the people that are calling this type 3 diabetes are really, I think they're probably pretty close. I think that's might be an accurate representation of some of the condition or some of the cases of Alzheimer's disease that we're seeing. Again, there's a lot of research that needs to be done, which is why we're doing this research with the ketogenic diet. I don't think we're there where we can say it does improve Alzheimer's yet, but I think that there is our study, and there's a couple other studies across the US that are being done in this area, and they may help us better understand if it actually is good for treating Alzheimer's or not. So I'm really excited to know what we learned from that. Do any of your trials enroll patients with MCI? Yeah, actually the CABA study will include, it has a pretty wide inclusion range. So I believe that we actually, whether you have Alzheimer's or if you have MCI, I think you could potentially be eligible for that study. I do know that there are other enrolling studies. I don't know all of them right off the top of my head. If you are interested in seeing if you do qualify for a study, I would suggest calling and talking to someone at the Alzheimer's Disease Center. That way they can tell you specifically what studies you may qualify or not. What is the difference between the Mediterranean diet and the MIND diet? That's a good question. The Mediterranean diet is it's sort of hard to describe because it is sort of generic in a way. It's never really been defined specifically, and that's really where the difference between the Mediterranean diet and the MIND diet exists. The MIND diet consists of a lot of the things that the Mediterranean diet consists of a lot of the things that I talked about that are on it. Where the MIND diet is different from the Mediterranean diet, though, is that the MIND diet has very specific recommendations. So they're very similar. The MIND diet is based off of the Mediterranean diet, but those specific recommendations that I showed to you are the specific, that's where it differs from the Mediterranean diet, is they give you really good guidelines.
And we are at 2:30. Do you have time, Dr. Taylor, for the last questions?
Let me answer just a couple more questions. I see a couple that are really good here. So someone asked whether or not the brain prefers to burn glucose or fat. This is a controversial topic. For years and years, we've always thought that glucose is the source that the brain wants the most, but there's some recent evidence that suggests that the brain may prefer ketones. So the answer to that is still needs to be learned, I think. But what we do know is that the brain can use both. It uses both well. And in these conditions where glucose metabolism isn't working quite as well, ketone metabolism still does. So yeah, there's a lot to learn. And I think that's a really good question. There's a question about total energy. I guess I'm not sure what that is referencing. Does anybody have a specific question regarding total energy? Okay, I think I'm not quite sure what that question is asking, so I may